Hello guys, now we shall be discussing about the next group of infection, that will be Tinea Capitis. Okay, we shall be discussing regarding Tinea Capitis. Okay, so in all these infections like Tinea Capitis, Tinea cruris, pedis, what we have to discuss is we have to discuss the location, right? We have to discuss the location, we have to discuss the risk factors, we have to discuss the type of rash, characteristic type of rash, and the treatment procedure. Okay, so first thing is we shall start by discussing the location. So where this infection most commonly occurs, this infection you see most commonly capitis in the sense cap, I mean the head. So either it can be in the head region or it can be in the scalp region. Okay, next after the location we shall be discussing about the characteristic of this infection. Or regarding the characteristic of this infection, the first important thing is that this infection causes lymphadenopathy. Apart from lymphadenopathy, it also causes another important thing, that is there will be rash, right? On the scalp itself there will be rash. On the scalp itself there will be rash, there will be itchy rash, right? So there will be itchy rash with scales, so itchy and scaly rash, and this is associated with alopecia. Associated with alopecia. If you look at this picture, you can see the rash is little bit scaly, and in the center there has been no hair here, right? So there is no hair here. It means this rash is associated with alopecia. So this is Tinea Capitis. Next important thing is that which group of people, what are the risk factors? Mostly this rash affects the African American descents, right? So this mainly affects African American people or Caribbean descent. Caribbean descent. Now when it comes to the treatment part, so what is the basic treatment which you give to these patients? The basic treatment are you start giving oral antifungal drugs. You cannot give topical because topical drugs, they don't enter in through the scalp, through the layers of the scalp, so they are not effective. So that's why you give oral antifungal drugs, right? So this is a short information which you need to know regarding Tinea Capitis, and this would be more than enough for you, I think. So thank you so much for watching my lecture. Goodbye.